Bismillahirrahmanirrahim. Assalamu alaikum, everyone. I am Dr. Alishpa Rasool, and today the topic of my presentation is surveillance under the kind supervision of Professor Dr. Saira Afzal. The learning outlines of my presentation are surveillance, types of surveillance, purposes and uses of surveillance, methods of surveillance, surveillance cycle, difference between surveillance and survey, conclusion, recent advances, and MCQs. Learning outcome. By the end of this presentation, participants will be able to describe surveillance, types of surveillance, purposes and uses, methods, surveillance cycle, and difference between surveillance and survey. What is surveillance? The ongoing systematic collection, analysis, interpretation of health data for use in the planning, implementation, evaluation of the public health practice, closely integrated with timely dissemination of these data to those who need to know. Ranges from the compulsory notifiable diseases, specific disease registries, population-based or hospital-based, continuous or repeated surveys of representative samples of the population to aggregate data for recording trends on consumption patterns and economic activity. Components of the surveillance. The enabling components of surveillance systems may include laboratory diagnostics to detect or confirm the health conditions, information technologies to support the surveillance processes of data collection, analysis, and dissemination, clinician consultation and reporting, laboratory worker education and training, legislation, regulations, policies that support the conduct of surveillance, systems and directories for disseminating alerts, bulletins, clinical guidelines and prevention recommendations, program administration and management, and human factors. Public health surveillance. It serves as an early warning system for impending public health emergencies. It documents the impact of intervention or track the progress towards specified goals, helps guide the health officials and programs in directing and conducting disease control and prevention activities. However, surveillance does not include control or prevention activities themselves. Surveillance should not be confused with medical surveillance, which is monitoring of the exposed person to detect early evidence of the disease. Public health surveillance at the local level. Surveillance triggers the basic public health investigations of disease outbreaks and specific control activities predominantly for the infectious diseases and environmental hazards. The main national level activities are measuring the trends in risk factors and disease, monitoring the effectiveness of the specific interventions, conducting more complicated analysis to determine risk factors, and providing technical assistance. At intermediate level, state, provinces, etc., public health agencies typically share both perspectives. The purpose of surveillance: to establish the baseline of a health condition, estimate the magnitude of the health problem, determine the nature and history of disease, understand trends and patterns of disease, detect the outbreak or emergence of new disease, identify the resources needed during and after public health emergencies, evaluate the public health programs and control measures, monitor changes in the infectious agents, set research priorities, stimulate research, inform research plan and implementation, support public health program planning, monitor changes in public health practice. Source. How can surveillance data be used? Estimates of a health problem, natural history of disease, detection of epidemics, distribution and spread of a health event, hypothesis testing, evaluating the control and preventive measures, monitoring the change, detecting changes in the health practice, and facilitate planning. Number one is the estimates of a health problem, quantitative estimates of the magnitude of a health problem, including sudden or long-term changes in the trends or patterns. Natural history of the disease, portrayal of the natural history of disease, clinical spectrum of the epidemiology. Third is the detection of epidemics. The line graphs below give a detailed overview of the current and historical case recovery, death counts throughout Pakistan. It shows the exponential growth of the pandemic in country by using a linear scale for the y-axis. It's also used for the distribution and spread of a health event. Facilitation of the epidemiological and laboratory research. Evaluating the control and preventive measures. Monitoring changes in the infectious agents and host factors. Detecting changes in the health practice and facilitating planning. Identify target populations in need of health services, refugee populations, morbidity surveillance in emergency shelters. Identify health topics to be assessed by the educational programs and media. Outcomes. Surveillance is outcome oriented, can measure the frequency of an illness or injury, number of the cases, incidence and prevalence, can measure the severity of the condition, hospitalization rate or case fatality rate, can measure the impact of the condition, orient the data by place, person, and time. What should be under surveillance? Establish priorities based on frequency, incidence, prevalence, mortality, severity, case fatality, hospitalization rate, disability rate, years of the potential life lost, cost, direct or indirect, preventability, communicability, public interest. Will the data be useful for public health action? Case definition is a specific set of criteria and guidelines used in the epidemiology and public health to define and identify the cases of a particular disease or condition. Case classification, clinically confirmed. Any person meeting the clinical case definition of a suspected disease cannot be discarded. Laboratory confirmed. A case that meets the clinical case definition has laboratory confirmation of a disease agent. Epidemiologically confirmed. A case that meets the clinical case definition and is linked epidemiologically to a laboratory confirmed or other epidemiologically confirmed case. A suspected case that has been subjected to serology or virus identification but has not met any of the laboratory criteria for diagnosis, or a suspected case which has been linked epidemiologically to a confirmed case of another communicable disease. The case definition examples. Case definition, clinical case definition of suspected measles. Any person in whom a clinical suspected measles or any person with fever and generalized maculopapular and cough coryza or conjunctivitis. Laboratory criteria for diagnosis of measles. Presence of measles-specific IgM antibodies is the recommended method for measles diagnosis. Outbreak case definition differs from the routine surveillance. Epidemiologically linked cases often included. A surveillance method is a systematic and structured approach to collect, monitor, and analyze data or the information over time. Important to clearly define the condition, ensure same criteria are used by all, makes the data more comparable, include person, place, time, may define suspected and confirmed cases, may include symptoms, lab values, time period, population as appropriate. Surveillance methods, standardized instruments, field tested. Passive surveillance, providers are responsible for reporting. Health department waits to receive the reports. Problems with underreporting. Active surveillance, health department initiated, providers contacted on regular basis to collect information, more resource intensive, used for outbreaks or pilot studies. Screening is essential step in surveillance. Active versus passive surveillance, to assess the trends, to identify the risk factors for the prevention and control. Active surveillance, to validate the passive surveillance systems, to loosely track new invasion. Pros: passive surveillance is inexpensive and cover large areas. Active surveillance is more accurate and complete data, can produce early and timely data. Passive surveillance consequences: underreporting and incomplete data. Active surveillance consequences can be resource intensive. Methodology must be well developed. Data analysis, ongoing review, descriptive stats, multivariate analysis, and automated analysis. Interpretation and dissemination, presentation of data in the form of table, graphs, maps, disseminate the data in the form of morbidity, mortality, weekly reports, surveillance summaries, surveillance reports, annual summary, and medical literature. Evaluation. Did the system generate needed answers to the problems? Was the information timely? Was it useful for planners and researchers? How was the information used? Was it worth the effort? What can be done to make it better? Cycle of surveillance, data collection, pertinent, regular, frequent, timely. Consolidation and interpretation, orderly, descriptive, evaluative, and timely. Dissemination, prompt to all who need to know. Data providers and action takers. Action to control and prevent, and evaluation. Initiating the surveillance system activities to the disease that has proved control measures available. Define how data collected shall be used. Set a standard case definition. Use the existing system. Visit those who supply the data. Develop a database. Develop a regular reporting system for distribution. Disease selection for surveillance eligibility criteria. Public health problem. Quantitative burden of disease. Impact. Clinical spectrum, severity and communicability, epidemic potential. Preventability in terms of feasibility and cost. Risk perception, global health organization, national authority, NGO, people, political pressure. Prerequisites of an effective surveillance system: standard case definition, enumeration of reporting units, system for disease surveillance, notifiable disease reporting system, laboratory-based surveillance, hospital-based surveillance, and population-based surveillance. Diseases notification: report of cases individually and collectively. Report of epidemics: case report universally required under international health regulation or as disease under WHO surveillance. Case reports regularly required whenever a disease occurs. Report to the local health authority by the fastest means, selectively reportable in endemic areas. Obligatory reporting of the epidemics. Steps for disease notification: collect the basic data, health facility, compile at the district, state, and national level, report at the district, state, national health authority to WHO. Types of surveillance: a focused location for surveillance, such as a health facility-based surveillance or a community-based surveillance. Surveillance conducted at laboratories for detecting events or trends not necessarily evident at other sites. A designated or representative health facility or reporting site for early warning of the epidemic or pandemic events. Sentinel surveillance. Disease-specific surveillance involving activities aimed at targeted health data for a specific disease. Syndromic surveillance: it is used for early detection of outbreaks to follow the size, spread, and tempo of outbreaks, to monitor the disease trends, and to provide the reassurance that an outbreak has not occurred. Its objective is to identify the illness clusters early before diagnoses are confirmed and reported to public health agency, and to mobilize a rapid response, thereby reducing morbidity and mortality. Electronic surveillance. National Electronic Disease Surveillance System, a set of criteria developed by CDC that all public health surveillance systems must meet, used to manage the statewide reportable disease surveillance data supported by the CDC funds. Sentinel surveillance: monitoring of the rate of occurrence of specific diseases condition through a voluntary network of doctors, laboratories, and public health departments with a view to assess the stability or change in health level of a population, is used to obtain the data about a particular disease that cannot be obtained through a passive system, such as summarizing standard public health report. Data collected in a well-designed Sentinel system can be used to signal trends, identify the outbreaks, and monitor the disease burden, providing a rapid, economical alternative to other surveillance methods. Data sources. Data collected through vital registration, disease notifications, environmental monitoring, and population surveys are commonly used for surveillance of health-related problems. Data from randomized clinical trials typically cover only a specified selected population, are used to answer the specific questions about the effectiveness of a particular treatment. They're not useful for surveillance. The data sources are vital stats, notifiable disease registry, sentinel surveillance, syndromic surveillance, surveys, and administrative data. Interpretation of the surveillance data: limitations, underreporting, biased reporting, inconsistent case definition. Consider context, seasonality, recent policy changes or intervention. Limitations of the disease reporting: underreporting, reporting better for more serious diseases than those for which there is a laboratory confirmation. Need to seek the medical consultation to be diagnosed and then reported. Lack of representatives of the reported cases and inconsistent case definitions. Reasons for not reporting: assume someone else reported, do not know reporting was required, don't have a copy of the reportable disease list, do not know how to report, don't have form or telephone number, concerned about confidentiality in doctor-patient relationship, no incentive to report, time-consuming, unaware of the value. How to improve the reporting? Contact physicians in the community. Tell them the health department is very interested in morbidity reporting. Maintain a reasonable list of reportable diseases. Maximize contact through presentation, mailings, newsletter, media. Use the data. Good surveillance system: simplicity, ease of operation, minimum paperwork, simple definition using existing system. Acceptability, flexibility, sensitivity, predictive value, representative, timeline regularity, data quality, complete, reliable, accurate. Cost effectiveness. Surveillance and survey. Surveillance has been defined as the systematic collection, analysis, interpretation of the health data, and the timely dissemination of such data to the policymakers and others. Survey is a method of gathering information from a sample of people, traditionally with the intention of generalizing the results to a larger population. 4 methods of survey are the face-to-face survey, telephone, self-administered paper and pencil survey, self-administered computer surveys, typically online. Surveillance provides the knowledge to support the health promotion and disease prevention, and it should take place in the context of efforts to improve the population health. In contrast, surveys are often done only once to determine the distribution of risk factors in the population at a point in time. Baseline survey is often the first step towards initiating surveillance first step and become an ongoing surveillance system that builds on multiple sources of health information. Allows to collect the limited number of data, allows to collect the wide variety of data, always tries to collect data on every case of disease. Usually data collection is done on a sample of population. Data collection only for the numerator, we have to get the data for the denominator from other resources. While on the survey, the data collection that allows to calculate the incidence and prevalence rates. Conclusion, surveillance provides information on the health of the community. Public health relies on information from the medical care providers and takes prevention-oriented actions based on information received. Surveillance involves taking information in, analyzing and interpreting it and disseminating it into those who need to know. Recent advances. Infectious disease surveillance in Pakistan challenges efforts and recommendations. Public health remains a major concern in Pakistan with communicable disease including HIV, hepatitis B, C, and TB, the leading cause of morbidity and mortality. Several factors contribute to the country's high risk of infectious disease epidemics, included overcrowded cities, unclean water, inadequate sanitation, poor socioeconomic conditions, low vaccination coverage. Due to absence of a comprehensive surveillance strategy and mechanism, it has been difficult to manage the infectious disease outbreak effectively. The hand, foot, mouth disease sentinel surveillance system in South Korea, retrospective evaluation study. South Korea has implemented a hand, foot, mouth disease surveillance system since 2009 to monitor the incidence trend and identify the disease burden. This nationwide surveillance involves a network of approximately 100 pediatric clinics that report all probable and confirmed hand, foot, mouth disease cases. Following the COVID-19 pandemic, infectious disease surveillance system must be evaluated to ensure the effective use of the limited public health resources. The study aims to evaluate the hand, foot, mouth disease sentinel surveillance system in South Korea, focusing on the transition period after the COVID-19 pandemic. This is the first study to evaluate the hand, foot, mouth disease surveillance system after the acute phase of the COVID-19 pandemic. The study showed the completeness, sensitivity, and the age representatives or representativeness of the hand, foot, mouth disease surveillance performance were temporarily reduced to moderate levels from 2020 to 2021 and recovered in 2022, while the timeliness and the geographic representativeness were maintained at a good level throughout the study period. We identified a temporarily reduced level of performance, completeness, sensitivity, and age-specific representativeness during the acute phase of the pandemic and good performance in 2022. Surveillance system evaluation and maintenance during the public health emergencies will provide a robust and reliable data to support public health policy development. Regular staff training programs and reducing the staff turnover will improve the hand, foot, mouth disease surveillance system stability. Now it's time for the MCQ session. Public health surveillance is one of the methods that a community can use to monitor its population health by detecting the problems. At the national level, surveillance triggers which of the following level of activities? A, investigation of the communicable disease outbreak. B, investigation of the non-communicable disease. C, specific control activities predominantly for the infectious disease. D, specific control activities predominantly for the environmental hazards. Monitoring the effectiveness of specific interventions of disease. Anyone would like to answer this question? It's E, monitoring the effectiveness of specific interventions of disease. The XYZ public health surveillance team evaluated the male patients for prostate cancer at the ABC hospital. What form of surveillance is being conducted? A, active, B, passive, C, sentinel, D, syndromic, or E, event-based?
A, active.
It's E, event-based. Public health surveillance programs should improve the public health system's efficiency and effectiveness, which is a key factor in the population health from a societal perspective. Which of the following are not typical uses and applications of the public health surveillance? A, identifying and treating each case of malaria. B, helping health officials allocate the disease control resources. C, changes in the proportion of children in a community with high blood lead levels. D, disease prevention and control program. E, varicella incidents after a law requiring vaccination. It's D,
C, changes in the proportion of children.
it's D, disease prevention and control program. High quality representative data from government owned high HIV monitoring systems are critical for national HIV intervention, especially among priority populations. Which of the following is the most effective way to keep an eye on the spread of HIV and AIDS? A, active, B, passive, C, sentinel, D, syndromic, or is it E, event based?
D, syndromic surveillance.
It's A, active. Public health surveillance in any XYZ country is important to monitor the public health practice. At the local level, surveillance triggers basic public health investigations of disease outbreaks and specific control activities predominantly of A, chronic disease, B, communicable. C, occupational hazards, D, presence of virus in the mosquitoes, E, non-communicable disease. Does anyone like to answer this?
I guess it would be E. E or A.
It's the presence of viruses in the mosquito. Any XYZ country's population's health improvement depends on surveillance. Which of the following statements most accurately summarize the public health surveillance? A method to monitor the occurrence of the public health problems. B, a program to control the communicable disease outbreak. C, a program to control the occupational disease. D, a system for collecting health related information. E, a program to control the non-communicable disease. It's C, a program to control the occupational disease. Data and information from the public health surveillance are used to assess and characterize the burden and distribution of the adverse health occurrence. Public health surveillance includes which of the following activities? A, disease control, B, disease elimination, C, data collection and analysis, D, disease eradication, or is it E, disease extinction?
It's A, disease control.
Let's see. A TB surveillance was done by an XYZ public health surveillance team by examining the hospital discharge data to identify the cases. What form of surveillance is conducted in this example? A, active, B, passive, C, sentinel, D, syndromic, or is it E, event based?
It's C, sentinel surveillance.
It's A, active surveillance. ABC's country's public health surveillance system produce cancer data and information to access and describe the burden and distribution of cancer adverse health occurrence. However, the surveillance system of ABC country does not encompass which of the following activities? A, data collection, B, data analysis, C, data interpretation, D, disease eradication, or is it E, disease data dissemination? It's B, data analysis. Effective public health systems in XYZ country collect data in a standard method, analyze it often, and communicate the results. Which of the following is a common way to collect data for surveillance? A, action research, B, case report, C, quasi-experimental, D, randomized clinical trials, E, disease notifications. This is the key of my MCQs. Thank you, everyone.
Thank you, Dr. Jispa.